My full name, just so we're all community here, so you should know everything about somebody, is Kevin A. Elliott Lawhorn. I have one of those weirdos that have two middle names. Um, we'll get into it later of what they mean, but from born in California, moved to Boise, Idaho when I was younger. Born there, I feel born there. I mean, I definitely feel Idahoan. I've been there for long enough that it's a contentious topic, but I know that I'm Idahoan for sure. But grew up there. Um, Boise is the best as far as I'm concerned. I was definitely convinced myself that I would be a physician. Cardiothoracic was definitely the preference of choice. My uncle Jeff is an orthopedic surgeon in Seattle, and his family is a prominent in physicians in the Seattle community. And I was kind of the black sheep family like him. We were more, uniquely extroverted, but definitely more studious, definitely more introvert in the sense of what our like disciplines we chose and how we wanted to study, and that educational and just that drive. But as soon as I was pre-med at Boise State when I graduated high school, immediately went into a job as a certified nursing assistant in high school as well, and then also got a job at a large medical supply company headquartered in Boise, by barely 18, 19. Worked there about 7.5 years, climbed my way up there, managed some different territories, was responsible for overhauling wound care clinics. And they had convinced me to transition to business administration. I never looked back. But the things I learned there were just like instrumental to my career. I mean, it was a phenomenal company, and the freedom and autonomy they gave me to be both entrepreneurial driven in healthcare, but also kind of pursue and disrupt the status quo, has something that's never left. I mean, now I have a career that has taken me, through entrepreneurial endeavors, and then also through, some of the pandemic response things. And then now I work for a company called Meridian. They are headquartered in Washington, D.C. We do federal healthcare consulting, and we disrupt federal healthcare. Our whole MO and the team that I lead is specifically on the growth team and the practice management side and case management side. Um, we we disrupt it. I mean, the way that health information flows, the way physicians optimize networks, and workflows, the way patients are retained and engaged, the way federal regulatory authorities report on the efficacy of the program. There's a lot. It's a physician-founded company. I had met the CEO and founder during COVID. I actually met her husband, who was a private equity firm founder, and we just all hit it off. They happen to be a very closely connected uh, family and friends of the current administration, and the rest is history. So uh, on a day to day, it's reading professionally for sure. Reading through different RFPs, preparing for different meetings. I'm the fortunate one, I guess, that gets to go sit down with majority of the secretaries, um, and division directors of just the operational divisions under like Health and Human Services, for example, even FDA, Social Security benefits administering. There's some ancillary stuff there. And then I'm also intimately close with CMS and the new CMMI models that are coming out, the creation of models, and also in the clinical Center for Clinical Standards and Quality, CCSQ, where hospital provider groups have to report certain data sets and what they have to do to remain, in alignment or in good standing with CMS. And so I have that, and then also the biggest challenge currently, I should rephrase that. It's not a challenge, it's just a opportunity that I'm very fortunate to be a part of is assisting on the team that is intimately reshaping policy and the care delivery advancements under military health. And so it's specifically working on site the Pentagon. We are actively engaged in transitioning from a a very antiquated care delivery health system into what they want to commercialize and disrupt in a commercial delivery or healthcare delivery system. And we are actively shaping policy in that particular side. We are crosswalking that to the Veterans Administration, and then we are going to take that same delivery to the CMS and commercial and private sector markets. And so it's very exciting to be part of. I'm humbled literally every day. But yeah, I have a wife and daughter. Some of the medical Lisas know my wife and daughter. I think I saw them. I think just one actually, but the yeah, they're the best. Met my wife at Boise State. The We were a one and done family. I have an 8-year-old daughter. She's almost 9. And I think I shouldn't say think we're getting a puppy. We're in like 2 weeks. So I still don't know how I feel about it. I know I'm gonna love it. It's been 5 years that my daughter says she's waited for a puppy. We couldn't have any more children, so the puppy has just been longing for one. And so I think we're going with a Bernie Doodle is what's going to happen. So um, that's the number one challenge for sure. Is just adjusting to life of a puppy while I go from Boise to DC about every 10 days. And yeah, well, luckily the hotel can get the puppy. The girls can come with me. Um, yeah, I mean, and a side note, I love cold plunging. I'm like obsessed with saunas and extreme cold. I live about like 600 yards from the Boise River, so I sprint out my front door. I jump in the spot that is like the river. Wintertime only. I don't want to do summertime. It's not the same thing. It's not it doesn't work. So I want 20 degrees. Jump in, go. Yeah, we're an outdoor family. My wife was a river guide on the Middle Fork of the Salmon River for the Forest Service for a number of years. And so we're just, if we're not in Boise or the city life with our careers, we're literally in the mountains and you can't keep us out. So it's a little about us.